Hello. So it sounds like our patient who's complaining of wrist pain and numbness and tingling in her hand might have carpal tunnel syndrome, which would make sense given her career as a secretary. Sounds like she does a lot of typing, probably sits in the same position all day, and her hands are probably getting pretty tired. Carpal tunnel syndrome is pretty common in positions or work that requires a lot of typing or writing. It's a repetitive use injury, typically as a result of a compressed medial nerve. So my assessment would be more of a focused neuromuscular assessment with special attention to her lower arm, her wrist, and her hand and fingers. So one test that we could do would be the Phelan test, also known as the wrist flexion test. So we'd have her rest her elbows on the table and allow her wrists to kind of fall forward freely. And individuals who have carpal tunnel will experience some kind of numbness or tingling in their fingers within a minute or so. So the more quickly she experiences symptoms, the more severe her carpal tunnel may be. So that would also help us determine how bad it is. We could also do the Tinel's sign, and for this test, I would just tap over her median nerve, her wrist, to see if it produces any kind of like numbing or tingling sensation in her fingers. So those are tests we could do right then and there. If we're still not sure, we could get an x-ray of the wrist if there's limited wrist motion, or if there's also evidence that there might be arthritis or other trauma, just to make sure we're ruling everything out. We could also get an EMG or do nerve conduction studies if it's super severe, and it'll help us determine how well the median nerve is working and how well it's controlling her muscle movement. So that would be up to her, or if we're not 100% sure, just from our physical assessment exam. Some treatment we could do for her, we can have her wear a wrist splint at night to help stabilize her wrist and hopefully reduce some of the pain she's experiencing that's waking her up. She could be prescribed NSAIDs like ibuprofen to help reduce some inflammation and swelling, and also obviously reduce that pain sensation she's having. There's also the option of cortisone injections, which is just a little more intense at reducing inflammation. And things she could do at work would be adjusting her sitting position, moving her keyboard to make sure that it's at an appropriate and safe level for her wrist function. And then at the very end of the list, if these treatments aren't working, or if her carpal tunnel is pretty severe and pretty limiting, we could consider surgery for her. Thank you.